rotator cuff tear. And now everyone around you is acting like your shoulder is basically completely totaled. Don't lift, don't reach, you'll just make it worse. You're going to need surgery. And let me be very clear about something. This is outdated thinking on this topic. Now we have decades of research looking at the comparison between surgical intervention and rehabilitation for complete rotator cuff tears. And there's an uncomfortable truth about it. A lot of people will do just as well in the long run without any surgery. They'll end up with similar pain relief, similar function, similar long-term outcomes. So this real question becomes, is your tendon torn, or what can your shoulder still actually do? And then how can we build from there? That's a better question. The MRI report is not your destiny, and this is where most people will get it twisted. They see that full thickness tear on the MRI and then they just suddenly assume, or they are told, well, it's broken. This is not true. We see people walking around all the time that have full tears, partial tears, degeneration. And we'd see that if we stuck them through an MRI, but if we asked them, they would say, my shoulder doesn't bother me at all. So at the same time, someone else may have a minor finding on an MRI and can't move their arm. So what does this tell us? It tells us first that structural damage is not an equivalent to the symptoms people are feeling. And if we look at what the research actually says about these things, high quality trials show us that if you compare surgery and rehab, there are no major differences in outcomes for most people. Successful repair doesn't guarantee you any sort of improved outcome, and re-tearing of the tendon even after surgical intervention is very common, and those people that re-tear may still feel fine after the second tear. So let that just kind of sink in for a minute. You can have a failed repair and you can still have improved function than before you had it repaired. So maybe, just maybe, we have been overvaluing the structural components of this and undervaluing improving people's capacity with these injuries. And a lot of rehab is going to end up failing for a reason. So let's call out that other side of this is, a lot of rehabilitation practices suck. And why? It's because they're built on fear. Here's your band that you're going to use forever. Here's some tiny little movements that you can do. Don't go where it might hurt. Let's stay safe. And that's not rehab. That is just slowly deconditioning people with extra steps, right? So we got to look at what actually tends to work in these situations. And it is well progressed, tolerable levels of loading. That means you use the range of motion that you have available, you gradually expand it, and then you load the shoulder in any way it can tolerate, and then you slowly, consistently demand a little bit more. Not in a reckless way, not in a random way, but precision, progressive, consistent. That is the way. Because the body will adapt to the stress you place upon it over time. Even if there's a full thickness rotator cuff tear, you can still improve the strength of the muscles in the area. You can still improve the coordination of the muscles and the joint. You can still reduce the sensitivity of pain in the area. You can still improve the confidence you have in using the shoulder. And we're not working around the damage. We are building a more capable system after an injury. So don't get this twisted. I'm not 100% anti-surgery, and some people are going to have it regardless of what anyone tells them. And there's a time and place to have surgical interventions, maybe in very acute traumatic tears, maybe in people that have high level overhead athletics as their performance that they're getting paid to do. Maybe if there's an extreme loss of function of the shoulder, and maybe if somebody did do a well executed rehab routine and still didn't have a good outcome, then we can look at it. But the key to that is they had to have, quote, failed a well executed rehab plan, not just 3 weeks of doing some stupid banded work and then quitting. So listen to the entire plan. Protect it, don't use it, and hope it heals. That's what a lot of people's plan is. And what ends up happening there is you just go backwards. The shoulder is not a fragile thing, it is an undertrained thing. And the solution isn't avoiding doing anything, the solution is rebuilding capacity. So if you are dealing with pain in the shoulder or a tear, stop asking, what is damage in my shoulder? Turn around and start asking, what can I build? And then go build it.